All right, we'll go ahead and get started. I'm Marie O'Neill, and I'm excited to welcome people to our webinar today, sponsored by the Michigan Center on Life Stage Environmental Exposure and Disease. It's an NIEHS center, and I'm pleased to introduce a dynamic duo of speakers. We have Aurora Lay, who's an assistant professor at the School of Public Health, and Marianne Rosemberg, who's an assistant professor at the School of Nursing. And welcome to both of you. And without further ado, I'll let you get started on your presentation.
Thank you so much, Marie. So thank you. Marianne and I will be co-presenting today on sustaining a healthy nail salon workforce in Michigan.
We all either have gotten our nails done or know a close family member or friend who gets their nail done on a regular basis. So when you walk into a nail salon, have you ever smelled a weird odor? Have you ever noticed that many of the workers either have an accent or either have some difficulty communicating with you? Unfortunately, people who work in nail salons, like many other immigrant workers in low-wage service industries, are often overlooked and work in conditions that can be harmful to their health. Because of the many factors such as lack of training, language barriers, and lack of regulations, these workers face increased workplace exposures and are at risk for poor health.
So really here with nail salon workers, they face a whole host of occupational hazards. And we want you to keep in mind that nail salon workers are predominantly women, about 80% of the workforce, predominantly immigrants, about 80% of the workforce, and largely Asian or Asian American. And every day they face a whole host of chronic chemical exposures, whether that be different types of phthalates, toluenes, formaldehyde, known human carcinogens. They also face infectious disease threats, whether that's hepatitis potentially now in the COVID era. A lot of clients don't realize that nail salon workers aren't supposed to cut live skin, and they are supposed to stop performing services when the patient or client starts bleeding, but sometimes that's not a clear delineation. They also face ergonomic hazards due to awkward posturing or bending throughout the workday, heat stress, workplace violence and discrimination, and electrical and safety hazards. And again, most of these are women of reproductive age between the ages of 18 and 44. So their chronic chemical exposures are especially of concern to us. Just to put a brief timeline of nail salon workers here in the United States, the University of California, Los Angeles' Labor Center has some awesome data that they've been collecting over the years. But originally back in the 1920s, even up to the 1960s, manicures were seen as a luxury for wealthy clientele, particularly white clientele. But the perception was that the manicurist was seen kind of like as a gossip monger or gold digger or hypersexualized because of the race or ethnic background they come from. In the 1970s, Tippi Hedren, the actress, she's considered the godmother of the nail salon industry because she really started training Vietnamese refugees and immigrants coming over from the Vietnam War to own and run nail salons and also work in the nail salon industry as a way to support themselves here in the United States. Nowadays, here we are in 2020 and beyond, and nail services have become definitely more affordable, but some of the issues that the nail salon workers face in previous decades are still quite pervasive. And here you can see as nail salon workers in regard to the English proficiency, their low wages, their educational attainment, and their median wage, it is pretty low relative to other types of low wage service workers here in the United States, which adds additional complexities when we're trying to protect their occupational health and safety, because so much occupational safety and health data, information, and training is solely provided in English. And as we'll get to later on, each state has different licensure and relicensure requirements for manicurists in all 50 states, and that can vary wildly. California is generally on the cutting edge of trying to provide language justice and cultural competency and information on labor rights and wage violations in multilingual options. But when we're thinking about a state like here we are in Michigan, those options certainly aren't available. Furthermore, you can see that they're not necessarily always insured, and many workers, nail salon workers, do work over 8 hours a day, but most on average are paid less than minimum wage, or they're paid a flat fee and not paid for any overtime work. Additionally, because this industry is largely staffed and employed by people of color, there is this issue that we reach with environmental justice and social justice, where again, we see these populations being the ones that are chronically exposed to different kinds of chemicals in the service industry, but very few protections towards them. You know, in the occupational health realm, a lot of folks focus on construction workers or those who work in oil and gas because of their high occupational hazards. But in these service industries that have comparable exposures and chronic exposures, they're often overlooked. So part of what Marianne and I focus on are on these occupational health disparities specifically within these sectors. And I also want to underscore that, again, because this industry is largely staffed by those who are Asian or Asian American, they have also been impacted by the COVID-19 pandemic. This is not only financially, but also from the racism that has paralleled the last 2 years. In the year of 2020, the FBI saw the report of hate crimes against Asians increased by 76%. And this is likely an underreporting because a lot of times they might not actually want to go to the authorities, or they don't think it necessarily merits reporting as a hate crime. So nail salon workers in turn are experiencing direct racism and microaggressions as well. And this all intersects with class issues, educational attainment issues, and so on. And I just want to underscore, you know, this NBC News article that came out last year. California has some of the highest volume of nail salon workers in the United States. We estimate that there's about 400,000 nail salon workers in the US, with about 100,000 residing in California. And during the start of the COVID-19 pandemic, about 40% of Vietnamese nail salon workers were forced to shut down for an extended period of time, up to 6 months or more, putting this economic burden, again, mostly on women and people of color. And unfortunately, without real evidence, there was unsubstantiated claims by the California Governor, Gavin Newsom, that the first community transmission case of COVID-19 in the state of California happened in a nail salon. And with myself being a Californian and knowing California are mostly run by Vietnamese owners, that definitely has a lot of negative repercussions financially for these nail salons, but it also feeds into this bias or these microaggressions or direct aggressions towards this population. And notably, nail salons, like it says in this quote, were left out of the governor's reopening plans, even though hair salons were given the go-ahead. So it's a very confusing message and puzzling and hurtful, especially because the community had banded together, making over 1 million pieces of PPE, specifically cough masks and those types of things, and donating the surgical procedure masks that they usually wear salons to help out health professionals during this time. So just a confluence of these issues that are becoming more and more pressing on this worker group. So the takeaway that we want to provide that nail salon workers are emblematic of low-wage immigrant women who work in the service industry, but are largely invisible in the communities that they serve, despite these elevated occupational safety and health risks. So that's what Marianne and I are here to do today, is to try to bring awareness to this group and underscore what we've been working on. So I'll pass it back to you, Marianne.
Great, thank you, Aurora. So we are the Michigan Healthy Nail Salon Cooperative, also called MHNSC. MHNSC is an interdisciplinary collaboration between the School of Nursing and the School of Public Health. MHNSC was established by our own Dr. Zellers, who was then the director of the Industrial Hygiene Program. So I joined a year later and have been co-leading the endeavor since. And with Dr. Zellers retiring, I'm glad that Dr. Lay joined in the fall of 2020 and has agreed to co-lead MHNSC with me moving forward. Our three major pillars are centered around advocacy, education, and research. And as you can see here on this slide, for advocacy, we use a community participatory approach to connect with and engage local nail salons to meet their needs. For education, not only do we educate the workers on how to best protect their health, we also train students across multiple disciplines at the University of Michigan who are interested in occupational health and safety. And our third pillar is research, as we focus on identifying factors that put nail salons' workers' health at risk, and also develop interventions to address these concerns. Next slide, please. So we conducted focus groups with nail salon owners and workers in the community. We recruited the participants by distributing flyers and connecting with the owners with whom we already have had a relationship with. We also developed recruitment scripts with and ourselves, along with students. We physically went out in the community so we could relay information about MHNSC as a whole, and also particularly about the focus group project we were putting together. The purpose of the qualitative study was to build upon our previous efforts by not only identifying the nail salon workers' experience, their perceived risks to their health, but also understand their needs and best approaches that they believe would help them work safely and also protecting their health. One of the focus groups was conducted in a conference room at a local library. The other two were conducted at two individual salons after hours once they finished providing services. We asked the participants to tell us about their experience as a nail salon worker. We asked them if and how they believe their work affected their health. We asked them to tell us about a story about something that happened at work that made them feel uncomfortable. And lastly, we asked them, if we were to develop an intervention, what should we focus on and what are the key components we should include? Next slide. Our analysis yielded three major themes, and each theme had specific sub-themes. In terms of work-related stress, the workers noted lack of standardized policies and regulations for their training. Some learned how to do nail salon work by attending a specific program, while others learned through shadowing at a nail salon. Also, the length of time of the training varied across states. One particular participant, for example, received their training in Ohio and worked in Ohio as a nail technician before coming to Michigan. And here's a quote from that participant. They said, "It's interesting in Michigan that there's that Michigan is a little less strict than they are in Ohio. In Ohio, state board comes around at least 2 to 3 times a year, and they don't tell you, they just show up." Another participant noted that in Texas, where they received their training, they were required to complete 600 hours, and they noted the contrast in Michigan, which required less training hours. Participants also noted a disconnect with what they learned in their training and real-world practice. They wondered about the safety of the products they were using, as well as experiencing pressure and discrimination from customers. Some reported experiencing symptoms such as wheeziness, sneezing, headache, itchy eyes, and pain related to poor ergonomics. When we asked about interventions, participants noted the need to have a refresher course for continuing education. They wanted to stay up to date with new products that were coming out. They emphasized the need to learn more about multiple things, such as chemical safety, as well as hepatitis and blood-borne pathogens. Next slide, please. So in direct response to the workers' expressed needs, we developed some brochures. We were aware that this was the most passive approach, but we worked on them in tandem of developing a grant application to develop a more interactive program to address the needs. Here are some examples of the brochures that we made available both in English and Vietnamese that we have developed as requested by the workers. Next slide, please. We also developed a walkthrough checklist and conducted a walkthrough at one of the salons. We're hoping to do more in the near future. When after we completed the walkthrough, we then wrote a letter to share with the salon owner our findings And in the letter, in addition to highlighting what was working well, we also included recommendations for the owner to consider. Next slide, please. As you can see from the previous slides, at any given time, we have many moving parts and multiple projects going through with MHNSE. We then moved further to develop an online training. We were able to secure funding from M-LEEaD to work on the first phase of this endeavor. We developed the content and used Canvas catalog for the training. And after we piloted the training with industrial hygiene and occupational health nursing students, as well as salon workers, we found that we needed to have something more interactive and mobile friendly. So we then proceeded to phase 2, securing funding from the Michigan Graham Sustainability Institute. Our next step is to focus on translation, translating the aspect of the interactive platform, the new platform that we are developing, and statewide dissemination. Next slide. So here's a screenshot of phase 2, which is currently ongoing. We plan to have 4 community advisory board meeting. We just completed our 3rd, I believe, 2 weeks ago. With a sustainability and environmental justice lens, we and our partners are blending technology, occupational health training, and salon industry-specific expertise to address disparities in chemical exposure and safety among this group. Back to you, Aurora.
Yeah, so just to provide insight on who is on our community advisory board, we wanted to develop this training to be as useful to the workers as possible. So obviously, Dr. Rosemberg and I only have so much insight because we ourselves are not nail salon workers. We focus on occupational safety and health, but really the practices are just so different. So we really do want to take this community-based approach and build trust within the community and incorporate this community advisory board. So we have 3 nail salon workers and 2 owners who look through all of our materials for the grants and provide feedback. Again, currently we're just in the English stage of this mobile friendly chemical exposure training because that's the funding we have for right now. But again, the ideal is to have it translated into multiple languages. So among our 5 CAB members, the mean age is 33.8, and it's about 60% women and 40% men. So it's a little more balanced in regards to gender compared to the overall nail salon worker population. And 80% were born outside of the US. And for those who were born outside of the US, all of them were from Vietnam. And 60% of them actually trained through shadowing or apprenticeship programs rather than a formal cosmetology program. So the cosmetology program here in the state of Michigan can span anywhere from 8 months to a year, but you have to pay tuition and that costs a lot of money, which a lot of these nail salon workers can't afford, especially if they're just getting here to the United States. So with the apprenticeships here in the state of Michigan, they usually shadow a licensed manicurist for about 300 to 400 hours before they can apply for licensure. Here in the state of Michigan, once they receive their licensure, they have to renew it every 2 years, but all they have to do is pay a fee. So there's no continuing education requirements. And with the evolution of nails from gels to acrylics, to a lot of nail design art these days and dipping powders being implemented, a lot of the onus is put on the workers themselves to try to learn these new techniques by either watching YouTube videos or speaking to our CAB members. They have nail salon vending stores that they go to here in Michigan, mostly in Madison Heights, because that's where the Vietnamese community is concentrated. And then they have representatives from these nail product companies that train the owners on how to do these new techniques. And they go back and do a train the trainer approach with their workers. But of course, it's focused predominantly on how to use the product and give a beautiful manicure and not necessarily on worker protections. To continue on, with our CAB, obviously we do want to acknowledge that they're a self-selecting group, right? So they have to be interested in improving their occupational safety and health and invested in making changes. So their reported earnings are higher than what we would expect to see, like out of that California report. So their average reported earnings are about $22 per hour. That includes tips as well. But the average hours worked per week for each nail salon worker across all 5 was 55 hours a week. No one worked less than 45 hours a week, and the owners, of course, generally worked upwards of 60 to 70 hours a week. And just briefly asking them what their self-reported health problems were, they talked about respiratory issues due to dust and fumes, back pain, ventilation systems not being on all the time. They're worried about inhalation and skin absorption, and they also have chronic headaches. And here in the state of Michigan as well, not every nail salon owner has to provide personal protective equipment to their workers. So one of our CAB members is supplying their own gloves and respiratory protection as well. And we had a few folks talk about concerns about getting cancer in the long term. When they were going through our training module, a lot of them said that they did recognize the words for things we covered, like toluene, for example, or formaldehyde or MMA, and they see it every day and they use it every day, but they had forgotten exactly what that short and long-term exposure effects were. So they did echo to us that it was certainly a great refresher and something that they might consider incorporating into their onboarding when they're receiving new employees.
So right now with the CAB, we are really working on building and sustaining collaborations with champions and stakeholders with the community. We are working on building a team that is culturally with a cultural competency approach, right? Culturally sensitive, given the demographic composition of these workers and issues related to trust with academia and government institutions. So we really want to establish a strong, trusting relationship with the community in order to serve them and move forward. Aurora?
Yeah, sorry. So our next steps and future goals is obviously to continue to champion for this worker group and raise awareness. A lot of traction nationwide right now around nail salon worker advocacy and focus on their health is in the state of California, the state of Washington, the state of New York, and big cities like Philadelphia, where there are larger communities. But no matter where you go in the United States and you go to a nail salon, you're likely to see an Asian American employee or someone running it. I have family members who work in the nail salon industry. And if you go to Frankfurt, Germany, which is where they live, or even Prague in the Czech Republic, you will find Vietnamese nail salon owners and workers. So we're trying to raise awareness here in the state of Michigan and throughout the Midwest, because they obviously exist in our communities, but their health and safety are overlooked. And our ultimate goal is to empower these nail salon workers to be a champion of their own health. Right now, we're just getting to the stage of awareness, but we want them to be able to speak up for themselves and make smart choices and be able to engage in a way with their work, because this is obviously their primary livelihood. We're not saying they should quit their jobs by any means, but figure out a way to do it more safely, and potentially for owners to work with vendors that sell products that are less caustic in terms of chemicals. And then also the big goal is to obtain external funding for endeavors like translation, for example. And translation in these languages is not as straightforward as it may be in some more commonly spoken languages. So in Vietnamese, for example, there are different dialects depending on which part of the country the immigrants come from, but there's also formal language versus colloquial language. So we've developed a great relationship with the California Healthy Nail Salon Collaborative, and they've spoken to us about how usually when they translate materials, they need to forward and back translate it through at least 2 to 3 different people in order to get the translation correct, so that it is best absorbed by who we're trying to target, because we don't want to use too formal of a language either. And obviously, we want to find out how COVID-19 has affected the industry, not only in terms of their business practices, but also these workers' physical health and mental health. And the ultimate goal is to integrate more occupational health and safety information into cosmetology programs. And Marianne, feel free to jump in here, but my general impression from us talking to the cosmetology programs, they don't spend a lot of their curriculum focused on occupational safety and health. So once we get this training out live, hopefully January 2022, we're starting it to distribute to nail salon workers. It's totally free. We're wanting to work with cosmetology programs throughout Michigan for them to potentially integrate this into a part of their curriculum. And we also want to create a cache of resources for nail salon workers to receive continuing education. There are a lot of great resources out there from, people working in the aforementioned states that I mentioned, but sometimes it can be just so difficult to parse through. Like, think about the amount of information we have received on COVID-19 and how to protect ourselves at work as native English speakers, and that already feels like just so much information. So we'd love to be able to create this centralized cache of resources for nail salon workers that's easily accessible, culturally and linguistically appropriate, and where they can just have like a one-stop shop, so to speak. And lastly, we would love to influence policy change at the state level. California has made great strides in terms of getting bills passed on mandatory product labeling and labor rights issues and all that. We would love to eventually pair up with MIOSHA and get them to think about requirements for continuing education and what that might look like in the future. And the workers themselves during the focus groups expressed that they wanted continuing education. That's not something that they wanted to shy away from. So lots of ambitions and goals for us. And right now we're just building and establishing ourselves in the nail salon worker community and gaining some traction. Okay. So I do want to acknowledge our previous funders here. So the different phases of things that we've gone through. So the COSI PPRT did help fund certain phases. Again, the phase 1 came from M-LEEaD, and then the current phase that we're working on right now comes from the Graham Sustainability Institute. Dr. Rosemberg and I are also targeting different centers and institutes at NIH to secure external funding. So hopefully there will be a positive outcome on that.
And as you see on the slide, we have a wide internal and external partnership network, and wanting to highlight the Vietnamese Association as well as the California Healthy Nail Salon Collaborative and the Workplace Without Borders, who one of the current director, the new incoming director of the Workplace Without Border, is actually one of our consultants for the Graham project. Did you skip a slide?
I did. Sorry, there it is.
So we would like to also thank all the individuals listed here on this slide who have supported MHNSC throughout the years. And I also already talked about Dr. Zellers, and really wanting to highlight Stephanie Saylor, who really had a big stake in getting this off the ground. And I always like to say, now that we know, what can we do about it? So I will apply this motto here. Let's get our nails done beautifully while protecting our workers.
So yay, okay, we stayed on time. So with that, I think we'll take some questions. I haven't had a chance to look at the chat. Let me take a look. Oh, I just see it's you, Marie. Okay.
Yes. Well, thank you so much. This was a really wonderful example of research that takes a community-based approach and, uses both of your expertise in qualitative research to actually learn from the population of workers that you're interested in protecting. I will just start out with a question. I know there are other, I think you mentioned the California Nail Salon Workers Collaborative, but I'm wondering, given, as Aurora pointed out, there are many people working all around the world in this industry. What are your long-term plans to connect some of the work and some of the resources you are providing in a way that can be used by populations beyond Michigan?
Yeah, I can start out, Dr. Rosenberg, if you want to take over after that, to add on to anything. So with California Healthy Nail Salon Collaborative, they're awesome. And we really appreciate their mentorship. So it's kind of a bi-directional flow of information and resources. They have been around for over a decade. So they've developed materials on COVID-19 and a lot of translated materials on information about the vaccines and so on, but they're fully involved and aware that we're doing this training. Nothing in this training in particular is super Michigan specific, other than the fact that we are making it here in Michigan, but we don't talk about Michigan continuing education requirements or anything like that. So the ultimate vision is that when we finish this training, we can provide it to our collaborators at CHNSC. We also attend their monthly work group calls for the Healthy Nail Salon program. So the counties there are aware of us as well. And recently, through another NIOSH endeavor that I'm doing, I was able to connect with one of the researchers at Drexel University in Philadelphia, who's also doing this kind of work out there. And then with the Workplace Without Borders, they've just formed a subcommittee for nail salon worker health that is not only going to be here at the US chapter, but also abroad. So I believe in previous years, Dr. Zellers has gone to Vietnam to conduct some of these trainings, and the goal is to continue that. They have a delegation from Ethiopia actually coming early next year to Michigan for other reasons, but Marianne and I have been asked to give a presentation to them as well. So I think with our approach, especially with the community-based approach, our goal is to never, hoard information or hold on to anything. Like, we want to get it out there. And thankfully with social media these days, it's super helpful as well. And we're very thankful to have a master's student who's more savvy with social media to help us out. Dr. Rosenberg, am I missing anything?
No, I think you captured it well, Dr. Lee. So if that's okay, Marie, was that okay? Did you want
Yes,
to build up on
absolutely.
that?
That was exactly what I was hoping
Okay,
to hear about. So thank you.
Thank
great.
you.
I see another question
Oh yeah, I
here
see questions. Yeah, so I
from
guess
Thomas
Dr.
mentioned.
Park.
Oh,
Okay. I just see Dr. Parks came in first. So
sure.
do we have data on nail salon workers' disease statistics like cancer? Are there any specific diseases related to nail salon work? I'll start on this, and then again, Dr. Rosenberg, feel free to drop in. So this is something I also forgot to mention. I teach a seminar that's going on right now that's available to students focused on nail salon worker health. So we've combed through almost like all the peer-reviewed literature out there, and unfortunately, there isn't much longitudinal data or studies collected on nail salon workers. Some try to use things like NHANES or birth registry data and connecting that to the occupation. But in terms of having a study where they focus on nail salon workers for an extended period of time, that has not really happened. We know that in nail salon workers, there are reproductive hazards. For example, placentia previa is more common among nail salon workers, but that was them looking at just birth registry defects, so to speak, and then processing that with who's a registered nail salon worker in California. Dermatitis is very common amongst them. Hepatitis B in particular as well, and that's quite prevalent in folks coming from Southeast Asia. A lot of respiratory issues, and just exposure to chemicals and fumes. One of our cab members, for example, said that when they first started working in nails, they had, it was like a 6-month-long headache. And it would go away when they came home from work, but would come back when they came to work. But they also weren't wearing any respiratory protection and didn't necessarily connect the two. So, there's a lot of this data that's out there, trying to connect the sources or anecdotal information from nail salon workers, but I would say it's not as clear cut as, for example, we know about cardiovascular risk in X worker populations. Dr. Rosenberg, do you have anything you want to add on to that?
No, you captured it all, or oh my gosh.
I'll let you take the question from Dr. Robbins.
Sure. Response of owners to the effort. I would say positive, right? But I think there's still the hesitancy, and that's what we're trying to break, right? Because MHNSC has been here since 2016, and here we're really working on focusing on establishing sustainability and collaboration. So one thing that we make sure we do is once we start connecting with them, we have to highlight that we're not coming from OSHA. We're not coming to do the citation, even to do the walkthrough checklist, that we really have to emphasize that we're here as a resource and for us to be seen as partners and not as people who are here to get them in trouble. So right now, with the cab that we have 2 owners, and we definitely see potential, that they're very vocal and very upfront in terms of really wanting to get things in the right place for themselves and also for the workers and for their salons. So right now, the other thing that seemed to work for them is we share with them that our long-term goal is to establish a healthy nail salon program where if they partner with us and really are establishing the occupational health and safety measures to protect the workers, then they would be added to a list, and that customers would then identify them as health, nail salon friendly, health friendly. Then that would boost their clientele, right? Because we have to get the buy-in. So that's what we're working on right now. Dr. Lay, you want to add anything?
Yeah, no, I think you covered that well. Again, I feel like establishing trust is so we have to be in it for the long game. These things don't happen overnight. And talking to the folks who worked in California and in Philly, it took 2-3 years. And then what happened was they were fortuitous enough to have a champion from the nail salon community that emerged and became like a key liaison or a partner that connected them. We don't necessarily have that liaison right now, but we have some fantastic bilingual students who also work in the nail salon community. Obviously, we don't want to solely rely on the students though, because they eventually graduate and have to go do other awesome things, right? But also word of mouth spreads really quickly within the nail salon community and the Vietnamese community. So they've maybe heard some things about us before, but we're trying to, set a good precedence. And also, I think it's a fine balance of we're trying to give the students a learning experience, right? Like the industrial hygiene and occupational health nursing students. We want to give them experience on sampling and all of that, but also trying to teach them about how to communicate with underserved and marginalized communities, because that's going to be such a huge part of their job, especially with the way the US workforce is looking. So we have to strike that fine balance as well between giving the students their learning experience, but also not wanting the workers to feel like, this is just a field trip for the class and they're not going to come back after this or something like that.
And I will say that our current research assistant is a Vietnamese student, and she is phenomenal, right? Not only in terms of connecting establishing connection with nail salon workers and owners and recruiting, but also giving us great feedback, right, in terms of cultural appropriate ways to do things. We found that very invaluable.
Yeah. So thank you. We have a question from Dr. Dolinoy. I'm also wondering about exposure monitoring for workers and clients based on type of service, especially among children and pre-adolescents. That's an awesome question. And to my knowledge, that data doesn't exist at all. We have a CAB member who did recently talk to us about his niece coming into the salon and immediately having an allergic contact dermatitis reaction, where she just broke out in hives throughout her body just from being in that salon and having exposure to some of the chemicals. But the exposure monitoring in terms of workers, Dr. Batterman, for example, has done one on volatile organic compounds here in the state of Michigan. And there's been a lot of personal air sampling and aerator monitoring in terms of like indoor air quality and chemical exposures. But when we're talking about other types of exposures, biological exposures, ergonomic assessments, that's not really happened at all either for the workers. So let alone like children and pre-adolescents. Unfortunately, we don't have a more satisfying answer than that. Do you have anything to add, Dr. Rosenberg?
Yeah, I wanted to say, so definitely, Dr. Delanoy, that's there's a need there for us to do. And I wanted to highlight Dr. Batterman's study. They did, personal monitoring, but it was the research team members who wore the device, and it wasn't the worker. So we definitely would benefit from having a study where we have the worker wear the device for that.
Yeah, but again, they are hesitant. They don't understand necessarily right away what it's for and are skeptical about what the outcomes might be. Dr. Colosino said, you might have discussed this and I missed it, but since this is a strong partnership with the workers, what is your strategy for reporting back results? For example, health and chemical biomarkers. Dr. Rosenberg, do you want to take a stab at this first?
Well, I will say that because we haven't done too much in terms of, these monitoring and things like that. So we can't say that we've done a lot of that. However, just the approach where we did the walkthrough checklist, we did go back to the owner and share the letter and things like that. And then our plan is to actually go back to the CAB and the other people in the community and share whatever other whatever findings we have moving forward. We haven't looked at chemical biomarkers or things like that. Yeah.
No, it's hard. It's hard enough to just get them to try to enroll in this training, let alone ask them to give us their urine or their blood, for example. So it's still a very delicate situation that we're trying to navigate. Obviously, that would be great to do in the future, right? Because biomarkers don't lie. They tell you what you need to know. But, for us, and usually in the past, what I like to do is always follow up with the workers, or at least the owner, to distribute with their workers a white paper that's 1 to 2 pages, predominantly like infographics based, because they're not going to read our journal articles. They don't care about it, honestly. But we always try to loop back with the owners and the employees so they don't feel like they're left hanging. And even in trying to establish the partnerships, we've offered up our ability, because we are academics, to help these owners write small business grants, or if they need somebody to look over it with a second eye, especially with English sometimes being their second, third, or fourth language, as a way to, again, try to build that trust. Ernie King says, how common is it for nail salon workers to move on to other lines of work, and what would these be? Or they're stuck forever in this kind of work? That's a great question. We were actually just talking about this on Monday with the working group that we have for California counties that are in healthy nail salon programs. Typically, I would say pre-COVID-19 pandemic, it was pretty uncommon for these kinds of workers to work in other lines of work, just because they are somewhat still insulated by the Vietnamese community. It's a lower language barrier and lower education and access requirements, especially if they've completed their apprenticeship. But, you know, now we're hearing with the COVID-19 pandemic, many salons have been negatively impacted. And once they temporarily close, they permanently close, or they had to cut back on 1 or 2 staff members, or they had to reduce the number of hours for folks. So some of these nail salon workers are transitioning into other parts of the service industry, like food, for example, and working at restaurants, but that still tends to be within like the Little Saigon or Little Vietnam within the community, where they can, again, like, you know, speak Vietnamese or their primary language. But once they're in it, they generally tend to stay in it, including throughout their reproductive years.
There is a question in the chat from Lauren, I think it's Smith, about whether we are addressing issues relating to trafficking and human rights.
That's a great question, Lauren. These nail salons partake in activities unlikely to volunteer themselves for research. So how might you reach out to workers under forced labor conditions? That's an awesome question. I think that's not easy to navigate at all. And we totally acknowledge this is a very pervasive issue. And even like, not just like, you know, sexual trafficking and human exploitation, but also having underage workers there. I think, first of all, I feel like we are at square one right now, right? Trying to establish these trust and connections with local salons who are invested. We have been sorting through recent Michigan licensing and regulatory affairs violations from 2017 to 2021. And all of those violations predominantly come from unlicensed nail salons with illegal activities going on. I think that is later down the line in our agenda, and I don't want to sound like we're just like turfing it, because we don't want to address it. But I feel like we can't, like with the legal activities, we're just trying to make some headway there. So before we get onto these larger issues, that we definitely need to have a more established network here in the state of Michigan, because those nail salon workers obviously know which salons are the ones that might be partaking in those kinds of activities.
Yeah, we have
that's
to
an unsatisfied answer, Dr. Rosenberg.
Yeah, we have to tread lightly, even when we are we recently submitted a grant for this worker group, and we had to address issue of documentation, right? And what we had to acknowledge is that we are not going to ask about it, right? Because we don't want to scare them, at least from the get-go. And if it does come up, you know, this is where you start thinking about what is your role and what is the end goal. So right now, like Aurora mentioned, right now we're really trying to show them that we are partners, we're on the same side, and then we'll take it one step at a time.
Yeah. Oh, sorry, Lord. We could chat more about that offline. Love to hear your thoughts and suggestions, because I know you're very integrated into the county as well. Marie, do we have time for one more question, or should we wrap it up?
I think there, if you can cover it briefly, I think Tom Robbins included it. So
yeah, so
great.
He asked possibilities in joining efforts to pressure the cosmetic industry to use safer chemicals in their products, more attention to safety warnings products, realize this is huge and difficult to get industry's attention. So actually, California just passed a bill where hazardous chemicals that have to be listed, and they formed like this new chemical database, which is like an awesome website that one of the partners in the working group has addressed. And even if these products are coming from overseas, like they brought them on Amazon or from China or whatever. So California has been really pushing this through. And the nice thing is, because California is so big and they have so much economic power and influence, generally if companies have to change something for California, they just do it as a blanket for everybody else. So we're hoping to see some positive movement on that front in terms of disclosures of hazardous chemicals, but we still have things like MMA, which has been banned, for example, since the 1970s. And Dr. Batterman's study, it's still like present in all the nail salons, right? So we also don't have enough occupational regulatory power to check every nail salon here in the United States. And sometimes the owners and workers don't even know that's what they're using. If I were to give like my 2 cents, I would say fund OSHA and NIOSH to the level of like other federal agencies, but that's my thought. So yeah.
And then,
Dr. Rosenberg.
if I could say something real quick too, I think this also has a big implication for larger policies, right? In terms of where MMA has been banned here, but if the product is being made, in an international region, right, there's no rules or regulation that's preventing people from buying it overseas to come over here. So I think that's something for us to think about as well.
Yeah, and in our working group for the Workplace Health Without Borders, they're now saying products that are banned here in the United States in the nail salon industry, they're just taking it to Thailand or these other countries to use there. So it has both positive effects here in the US, but negative effects elsewhere throughout the world. So thank you so much for all the thoughtful questions. Marie, do you have something final to say?
I just wanted to say thank both of you, Dr. Rosenberg and Dr. Lay, for a fantastic seminar, and really appreciate this and all the questions. So thanks everyone for coming to this seminar series, and tune in next Tuesday, same time, for another one. So applause and thanks everyone.
Thanks, everyone.
Thank
Hope you have a great, restful Thanksgiving break.
Yes. Great.
Bye.
Bye.
Bye, everyone.